Oh, okay.
See, we can show it.
Yep, running.
We can show it without sound, so it doesn't really matter.
So it doesn't matter what we say.
So the first thing we need to do is, and this one's already been largely done, is separate the diaphragm. So that's now,
Good thing I did that already.
yep. And you can,
Just pull it down as though it's a flap.
yep, you kind of want to move it downward.
Okay.
And then you can, I don't know if I should show.
Yeah, you can do that.
So the diaphragm has been pulled back. And then we just go north. And this is where it's important that they don't, they can gouge the heart pretty well if they're not careful.
So they want to use, is the sharp end okay?
It's, you need it at
beginning?
first. Yeah, and then once you get in, you can kind of,
Switch to the blunt
Yep.
end. Okay.
and you can expose the pericardium there.
Mm-hmm.
Okay.
So that's what we're trying to avoid hitting. But it's also helpful, I think, to kind of separate things out as we work, including, you're always going to have one side that has more than the other.
Mm-hmm.
So that side you can kind of tease apart with the probe. Sorry, Divya, I'm trying
Oh,
to...
you know what? I can see from up there. So
I know,
that's
but
fine.
that's not
Yeah, not
as
quite the same.
ideal.
Yeah, that's fine. I can see okay.
Similarly to when we teased apart the carapace.
Right, right. You
Okay.
just have to kind of tease it off. And generally, like once you get it going, it comes off just fine. So then you can start to see the structures that you're looking for. And then it starts to get a little bit trickier when you get to the neck.
Because you're trying to cut all the way up to like here, right?
Well, yeah, so the first part, here, I'm gonna,
Pause it.
well, I can't really pause, so we'll just keep going.
We can
The
edit
first thing
that.
we're doing is exposing the thoracic cavity, and that's truly a cavity. So you've got your lungs, and your heart, the pericardium. This is where it might be nice to have Andy. That gland, I think, is it thymus?
Yeah,
think
the
that's
thymus gland
thymus.
is down in the chest.
And it goes over the
The
heart.
thyroid gland is up in your
Right,
head
I
or
know
something
that
like
the thyroid's up there. I just can't
Maybe your
remember
neck
for
somewhere?
sure. What's that?
It's in your neck somewhere, your thyroid, isn't it?
Yeah, and we'll find that. But the problem with like testing about this is that we need to open the pericardium.
Right.
So it talks about the lungs, right? So you can see the lungs, the heart. Oh, so they want, then step 4 says to go to the trachea. So then we are going to go neck
Okay.
next. And so this I prefer to do sort of,
Do the like
Layer
the
at a
top part
time.
of the skin,
yep.
kind of.
And then I actually like to use more probe than scissors at this point to start teasing that material.
Yeah,
apart.
because you can see the tube there, right? Kind of.
Well, that's what's tricky is this is all like things tend to get a little mushed one way or the other. So I'm slightly off center, so there's more over here.
Mm-hmm.
So I like to start up here and find larynx because that's pretty obvious. And then you can track down from there.
Mm-hmm.
And
So
you can
is
find,
this the larynx right here?
yeah, and you can
that
feel
hard
it.
piece?
Yep. Oh, Divya, I didn't offer you gloves. I'm
Oh
sorry.
no, that's fine.
Yep.
Yeah, it's that hard piece there.
Okay.
Yep. And then the thyroid is is like kind of over it, so oftentimes you can't keep it. Like you can find it, and then it's not one that I generally have great success with students maintaining.
Mm-hmm.
Especially if you want them to see like the esophagus,
Right.
because that's underneath the trachea. So like there's the thyroid.
That's this thing.
It's two lobes, so it'll kind of go in a
Okay.
U.
Yep.
And this is also what's frustrating is everything
A
gets
lot
so
of connective tissue. In
well,
there.
and it gets so off center
Yep.
because unlike the
The abdomen.
abdomen, it's all connected.
Yeah.
Yeah.
This is all connected to the chest cavity, right?
Yeah, it was just all connected to itself. So what I try to do is get them to expose that trachea nice and obviously.
Okay.
And then if they can preserve one side of the thyroid, so that one, the other one's up here.
Okay.
Can you still see, Divya?
Yep, so.
And then
Okay.
the best bet for sort of confirming the trachea is to get them to kind of aggressively scrape at it with the
The blunt
blunt
probe.
probe. Or if they're gentle, they can use the sharp probe.
And you can start to see a little bit
And
of
you'll
ridges
start
in
to
there,
get
right?
the ridges, yeah. And they can kind of feel them.
Yeah, you can
This
see
one's-
them on
yeah.
this one.
This one's not as, yeah, that's actually a pretty good good view. This one's not as obvious, the like, brrr, when you
Right.
rub it with the probe.
Right, you can't feel them, but you can see them. Right?
Yeah, usually you can see them.
So then we take the blunt probe
Or,
and stick
feel 'em,
it
excuse
down
me.
his mouth and then
Well, yeah, you know, you
into
can
the trachea.
you can do that if you. I mean, one thing
Yeah.
I want to try to do is get the. You know, I have my one pig where the girls cut off the
Oh, yeah. And you want to try that?
glottis, and I want to try to get a large pipette in there and inflate the lungs.
That'd be cool.
And actually have them do this a lot, like,
Yeah.
and it grosses them out, but it really, like,
Yeah,
that's
you
so
can
much
hear it.
easier.
You can hear it spreading open a little bit.
But when they can do that, then they can really see the
Yeah.
lungs and other stuff a lot better.
Mhm.
So it's good to kind of pause at this point and make sure that they can see and identify those glands, right? Thymus, thyroid, trachea, the
Larynx.
and then the esophagus is the tube underneath. And usually there's one side or the other where you get a better view, and unfortunately it's on the same side as there, I'll pull it that way.
Okay. So it's
that
much thinner.
tube- much thinner and flatter, and there's a question in there that talks about why they need ridges in why they need ridges in the trachea and not the esophagus, right? So it doesn't matter if the esophagus collapses in
Right.
between eatings.
Right.
So, and then here's where, you know, it gets pretty muddy here, so you can't necessarily track the trachea into the lungs, or you'd need to remove the heart to see
Right.
that. And so that gets a little bit.
Because you wouldn't want to like start digging it around under here.
Yeah, and you know, like Ron
What is
Lacko.
this?
It's a pig. We're
It's not alive anymore.
no. We're videoing.
Oh, look at that. Oh,
Yeah.
that's cool.
And then that's
Sorry
going to
to
be.
interrupt.
That's okay.
Jeez.
We're not doing sound, so we're gonna do video for the kids if they
Wow, cool. Nice work, guys.
want. So then we can open the pericardium. I should make sure. Yeah, remove the pericardium from around the heart. So they found the
Okay.
larynx, trachea,
Yep.
lungs, blah blah blah.
And they don't need to go farther than this to find any other mouth.
No, we
Connections
don't have
or
to do
anything.
anything else
Okay.
in that neighborhood. So then the pericardium, if you can have them remove it in a way that they can still see the thymus, that's good, but not essential,
Not
you know,
essential.
because we'd rather them see
The chambers than
the chambers. Yes, exactly.
Because we can save other pigs to show them the thymus if we wanted to.
But if you do it right, I mean, I can kind of rewrap the heart, right? So like I can
Oh, yeah.
roughly put it back in place, but we want that visibility right there.
Okay.
Because then you can see, and actually this is a nice heart for what we need. So you've got, that's kind of trippy to do it that way. Right atrium, left atrium, right ventricle, left ventricle.
Right, and you can see the septum right in there.
Yep, yep. And what we hope for is that they can see a little bit of coronary arteries, but, you know, sometimes we'll often pin this on the test and say that is the coronary artery, or it's a coronary vessel anyway.
So it's not the septum. Or does it run together, kind of?
Probably parallel, yeah.
Yeah.
Okay. And then, so this is the picture that's missing from these instructions. So actually, I'm going to get out.
Oh, that one, okay.
So we only ever give them the dorsal view.
When, on the test, you mean?
Well, we don't have them cut out the heart to see
Oh, right, okay.
the ventral view. Or the
Because we can see the ventral view right now, right?
Yes, we see the ventral
Yeah.
view. We don't give them the dorsal view. Is what I meant to say.
Do we ask them either on this or the test about the aorta or the vena
Yeah,
cava
that's what I
or
was just
anything?
confirming. So the most obvious blood vessel is here, and that's the pulmonary artery. And you can see that it nicely exits the ventricle, right? The right ventricle, so you know it's going to the lungs. The aorta, you have to clean out more, and it makes me a little nervous to make kids do it because they tend to be a little bit more
Rough.
or they just, you know, it's not necessarily worth the payoff of having
Right.
them chew up that area.
Is that it right there, though? Did we see it?
Yeah, it started to get a little brown. Like I may have even punctured something like right there.
Yeah, that's the aorta.
That's the top of the aortic arch.
Okay.
You can sometimes peel things back and see the aorta coming down on the dorsal side, but not really in this one.
Yeah.
And then again, you can also, you know, like peel lungs away and locate some stuff under there. But I generally take them about this far. Like this is where,
This is where it's a good stopping point for the day, kind of.
yeah, and then there's not a whole lot else. Like
Right.
there's enough new structures for them to be looking at. I should look at the vocab list and see. We've got trachea, larynx, heart, lungs, pericardium, right and left heart, atrium, ventricles, aorta. This calls it the pulmonary trunk.
So that's that vessel.
Yeah, the pulmonary.
That's right here, the pulmonary artery, technically.
I always call it the pulmonary artery, but
Yeah.
pulmonary trunk,
Can you point to it again? So it's the,
right there.
Check the video here, do we?
oh,
So this, where my finger is.
okay, okay.
Big white vessel.
Okay, got it.
The aorta comes, you know, kind of from underneath and then curls over.
Right.
So we have it on the list, but
But if they were to point out this thing,
yeah,
right
there.
there, I think that would be
Right.
decent, right?
Yeah. So, and you know, maybe we experiment with this pig and try to take it more, maybe,
After we show them.
yeah. if
Actually,
we-
we'll.
like,
with
I guess
this
if you
video,
if you peel the pericardium back, you do get a better
Yeah.
view of it. So, I'm trying to. I think what I punctured was probably the vena cava
Yep.
right there. And see, that's the other thing.
Yeah, that's
Then
some
you,
fluid came out.
yeah. Oh yeah, there's a good view of the vena cava, both
So
superior and
that's
inferior.
Right here.
hmm
Is it this?
This is the superior and this is the inferior.
Oh, cool.
But I mean, it's also a good illustration of how thin they are compared to this, like that.
Right, yeah, that's
Pretty
bulky,
dramatic difference.
Where it's the thicker vessel, right?
Oh, that'll freak him out that it's moving.
That is moving.
It was like I had pushed it down so it like moved back.
Oh.
Yeah. Just wondering if we can. Yeah, I don't. I mean that. Oh,
Is that esophagus right there?
must be esophagus. Yeah,
Oh, cool. It is, isn't it?
I think so. Here we can confirm.
Are you looking?
By
Right.
This thing right here must be esophagus. Or
there.
this, where's the probe is, right?
Let's do this. We'll go.
Do we need to keep recording or should we?
No, we can probably turn it off. Thanks.